afternoon, everybody. My name is Elysia, and I, first of all, want to thank everybody for joining us. As you know, this is a webinar for our Transportation Leadership Academy that we are having. Today, our webinar is going to be about a case study from Nashville on integrating health into project selection. Like I said, my name is Elysia, and I am with the Transportation for America team. You have not all met me yet in person, but I will be there for our upcoming workshop. Just a little bit about logistics in regards to this workshop. We will be taking questions in two ways. One, via the chat box. If you are looking at the presentation right now, that's at the left bottom of your computer, and you can chat questions throughout the webinars. And then another one is via the phone. There are a few of you guys that are on the phone. You're all muted right now. I will unmute the lines at the very end when we do answer any questions. This recording is this webinar is being recorded, and we will have also the recorded webinar to you guys within the next couple of days. With that being said, I'd like to introduce somebody that you guys already know, Josh, and he will be talking a little bit about our upcoming workshop and today's agenda. Josh?
Thanks so much, Elysia. Josh Ostroff with Transportation for Massachusetts, and thank you all for participating, whether you're just here for the first time or you've been with the Academy from the beginning. So as you may know, if you saw a recent email from me, we've got some great programming coming up. On February 13th, as Elysia said, you'll be able to meet her in person. We have some really interesting speakers that day. We'll have Dave Christopoulos and Tim O'Day talking about some rural transit challenges and solutions. And then Christoph Spieler from the Houston Metro speaking about their bus network redesign. Then Chris Dempsey and I will lead a session around goal setting and how we can use the learning that we're developing through this academy to further your specific professional goals and objectives. So I don't want to step too much on the program and make sure that we have good turnout on February 13th. And then on March 6th, we'll have another webinar that will be all about messaging and how to ensure that we're able to get across complicated topics in a straightforward manner to the intended audiences. And that varies depending on what kind of organization you're working for. Obviously, an advocacy organization, and a municipality, and a regional transit authority and an RPA all have different people they need to reach. But we'll talk about all of that on March 6th. So, and then our final workshop is on the 13th. So thank you so much for being here today. And now I'm delighted to turn it over to Rochelle Carpenter from the Greater Network, Nashville Council to speak about health equitable transportation planning.
Thank you, Josh, and thank you, everybody, for joining us today. Elysia is going to advance my slides because I recently moved over to another organization, and I cannot download the software that is needed for me to see the PowerPoint and advance the slides. So thank you, Elysia. So I'm Rochelle. I work with the Greater Nashville Regional Council here in the Nashville, Tennessee region, and we have had a big problem in our region of not having enough sidewalks and bike lanes at a minimum, let alone the more advanced street designs that help keep people safe on foot and on bicycle. So we developed a project evaluation and scoring system that really prioritizes funding for bicycle lanes, sidewalks, and other improvements for people traveling on foot and bicycle. Nashville, the Middle Tennessee region, as you can see, Elysia, if you go to the slide just with pictures of Nashville, is a 7-county area, and we run the gamut from downtown urban development all the way to rural. With lots of suburbs. I think we're the 6th most sprawling metropolitan area in the country. So next slide to the information about the Healthy MPO Guidebook. I put this together. This is a publication of Transportation for America. It's a series of case studies of metropolitan regions and metropolitan planning organizations and how they have prioritized walking and bicycling projects in their funding. So check out this really great resource. The case study of the Nashville Area MTO's prioritization was emailed to you by Josh, so you have that, and it really covers what I'm going to be talking about today. So you don't need to take detailed notes or anything. Just sit back and think of questions that you might have to bring up after I'm done with the spiel, since everything is really well documented in the everything that I'm going to say today is well documented in the handout that you have. Next slide. So the Nashville Area MTO, of course, like your own metropolitan planning organization, receives proposals from all the jurisdictions and transit agencies for federal funding about every 5 years and makes selections of projects to fund through the regional transportation plan. So the last time around, our plan was adopted 2 years ago, February 2016, and staff evaluated every single one of the 400 proposed projects that we received that were seeking funding. You can see here on the slide some of the questions that we asked when it came to public health and environment and how well each of those proposed projects advanced those goals. Does the project have an air quality impact? Does it provide multimodal options to areas with higher rates of people who are underserved in our region? So we both did a qualitative and a quantitative analysis on every single one of the 400 projects at the staff level. And this is just an example of some of the questions that we asked. Next slide, Elysia. This shows you the categories that we use to evaluate all of our projects. So you can see here safety was really the most important thing, and we weighted components that would improve safety in a proposed project the most, all the way down to freight and goods movement. And through this scoring process, 80 out of 100 points that we use to score our projects directly relate to public health. Today I'm going to talk about 2 studies that we did in order to figure out the health impacts of proposed transportation projects. 2 studies that we did that helped us formulate this project selection framework. Are there any questions at this point? As we're wrapping up, big picture here before I get into the 2 health-related studies that helped us with our project evaluation and scoring?
So Rochelle, I don't see any questions yet in the chat box, and I'm going to go ahead and open up the mic right now to anyone that may have questions. So let me just do that right now. Anyone with questions on the phone?
Just general, because before we get into more specifics about what we did, I just want to make sure there's not I'm so confused about whatever. Okay, good?
Rochelle, I think you can continue. Yeah, I don't think there's any questions yet.
Awesome. Okay, next slide for the Middle Tennessee Transportation and Health Study. So this first study was done in 2012. We asked people who live in about 6,000 households questions about their health as part of the household travel survey. We also gave people in 600 of those 6,000 households an accelerometer and a GPS device for them to wear over a 4-day period, so we could see how many minutes they were walking or bicycling every day for transportation purposes specifically. So we collected a lot of data. Next slide. These are the 6 questions that we asked every single person in these about 6,000 households. And so everybody answered these as part of the household travel survey, and I want to draw your attention to question number 4. Would you say that in general your health is excellent, very good, good, fair, and poor. So that was a self-report, simple enough question to ask. We used the responses from that question in particular, and we ran an analysis of what kinds of demographic characteristics of people were different depending on how they answered this question. So we ran the analysis. We determined that people who were, if you want to run to the next slide, Elysia, project scoring vulnerable population. We determined that people or households with a higher than average rate of those four that you see at the top of the screen, poverty, without a car, unemployed, or over the age of 65, if there was a higher than average rate of households with those demographic characteristics, they were more likely to have self-reported poor health in our household travel survey. Taking those results, we identified where those geographic areas are in our metropolitan region, and every single one of the proposed projects that include some kind of walking or bicycling component to them that serve one of those areas would get more points in our project evaluation process. We also gave points to if the proposed project made it safer for people to walk or bicycle and served those 8 characteristics of vulnerable populations. So they could get up to 11 points just by serving an area with a higher rate of any one of these 8 demographic characteristics in our scoring process. The next study that I want to talk to you about, and Elysia, go ahead and advance to the next slide. We determined where in our region places like this exist. This is in Green Hills, and you can see there are shops, very visible restaurants, offices. There's residential areas on either side of the street, but it is very difficult to walk across or along this street. So we determined places in our region that had this kind of density development already, where people could walk from that McDonald's and then go get a dessert at the Wendy's, get a Frosty, or sign up with a T-Mobile plan, but wouldn't do that because of the poor crossing conditions. So we mapped out where there was a high rate of different kinds of developments within walking distance of each other. And we gave proposed projects in our region more points if they provided a walking or a bicycling component in an area that did have a higher density of existing destinations. Next slide. So some of the kinds of projects that received a lot of higher points because of this methodology. So this is arterial in our region in Columbia, Tennessee, about an hour south of Nashville, and they go ahead and go to the next slide. Submitted a proposal for this multi-use bike path on one side of the street and a sidewalk on the other side of the street. They got 8 out of 11 of those points for providing a walking and bicycling connection in an area that would serve 5 out of 8 of those demographic characteristics for underserved populations. So this project scored pretty well for the health equity points because it would serve households with a higher than average rate of not having a car, being of low income, being a single parent, and being in poverty. And next slide, Elysia. Another project that got 11 out of 11 of those health equity points for providing bicycling and walking connections for underserved populations is complete streets in our rapid transit corridors. Next slide.
Really quick, someone asked questions about what happened to the power lines on this slide.
What happened to the power lines?
Yeah.
Well, the project has not been constructed yet, but they could if they're gonna. This is a completely new facility, right? So they could more easily bury those power lines if they're going to put up a completely new multi-use path on one side of the street. But it has not been constructed yet.
Okay, thank you.
Any other questions?
No, that's the only one we have so far.
Okay. Yeah, feel free to interject anytime, everybody. So the Complete Streets project in Elysia, if you're on slide 13, Nashville, Tennessee, Rapid Transit Corridors, again, received 11 out of 11 of those points for serving every single one of the underserved demographic characteristics that we identified should receive more points. Our second analysis also tell us that we could actually see 4,000 trips on foot or bicycle every single day because of the high number of destinations that are diverse destinations, everything from retail to commercial to schools, within walking or bicycling distance from each other. So there's a lot of potential here for walking and bicycling trips if we put in sidewalks and if we put in bike lanes, which is why this project got more points than others. Next slide, same with this one in Goodlettsville, Tennessee. So this project will provide sidewalk improvements, lighting, which we know is really important for pedestrian and driver safety. Because of the higher diversity of destinations and land uses at this location, we predict that there could be 422 walking and bicycling trips every single day, just because of the existing land use. So wanted to help them realize that potential number by funding sidewalks and lighting in their region or in their development here. Any questions about that? Those two studies and how they informed our project selection?
No questions yet, Rochelle.
Great. Okay, well, next slide. So a result of all of this is that 77% of our road right-of-way projects do include sidewalks, bicycle lanes, or shared use lanes, which is a big improvement. It's the first time that we were able to run these numbers. Only 2% of our proposed projects included some kind of bicycle or walking component to them. And even in 2035, 70% of our projects included walking or bicycling components. So we have greatly improved by this. Lots of results. If you go to the next slide, I wanted to tell you a little bit about a new model that we are working with. It's called the Integrated Transportation and Health Impact Model. We have used these results to see that if people in our region who right now are only walking or bicycling for transportation for an average of 3 minutes a day, if they walked for 13 minutes a day, the average person, we could see a pretty great reduction in our chronic disease rates. You can see, go ahead to the next slide, Elysia. So here's just a few of the chronic disease rates. Is this better, Christina, if I talk like this? I saw that you said you can't, there was an echo. All right, I'll just proceed. But there's 12 different chronic diseases and respiratory conditions that could be reduced if people were bicycling or walking more for transportation purposes, specifically every single day. And we use this model to help us calculate those predictions in disease reductions. And we worked with staff from the Centers for Disease Control to run these numbers. There are staff from University of Wisconsin who are trying to make this model easier for MPOs to use because it is pretty time intensive right now to input all the data required to run this model. But soon I hope there will be a model that can allow an MPO or a county even to run this model pretty simply using nationally available data. So, yeah, I just wanted to share a little bit about what our MPO is doing to advance projects and how we score our projects, evaluate them for public health. And that's the end of my presentation. So if there's any questions, happy to answer them.
Thank you, Rochelle. I'm going to go ahead and open up the lines. I see that a few people are on via phone. So if you guys have any questions, if anyone has any questions via computer, please write them now via the chat box. And then, Josh, do you have anything else you want to say?
Well, I am interested. Thank you, Elysia. Thank you, Rochelle. It's really interesting to see the experience that you've had. Where does that, from a statewide effort, who's making some of these decisions in Tennessee?
Mm-hmm.
That is the DOT adopted a lot of these practices and perspectives?
Yeah, the state DOT has been a really good partner and coming up with a complete streets policy for their department. And right now, their big, a big thing that they've been doing that's had a lot of momentum is identifying high crash corridors in the state of Tennessee, specifically in Nashville region, Chattanooga region, and the Memphis region, where there's been a higher number of pedestrian and bicyclist fatalities in particular. And they identified these corridors and are identifying improvements to make to those corridors and have a small amount of funding right now for the first pilot year to make some of those improvements and are hoping to expand that. So yeah, the state has been pretty great at slowly but surely adopting complete streets policies and integrating those policies into active transportation or multimodal guidelines that are going to come out soon or be adopted soon, which is really a key. So allowing the engineers to proceed with street designs that better accommodate bicyclists and pedestrians. That's going to come out soon.
And thank you for that. And then where do advocates fit into this? In Massachusetts, it's really been the advocacy community that pushed for years for complete streets and for project selection, and now it's become more institutionalized. Was that the experience in Nashville, or was this more of a, call it top down, if it was something that the MPO really initiated?
Yeah, it was pretty staff driven, I would say, this project selection methodology. I mean, we do have a bicycle and pedestrian advisory committee who we work with, but advocates in our region are more focused on individual projects, so have less capacity to take on things like performance measurement. So I'm really impressed with advocates in the Boston region that can and continue to have help the MPOs and the state DOTs with these performance measurement. I think that's awesome. But advocates in our region aren't as focused on that because they're more focused on individual projects.
Thank you. Yeah, I'm interested to hear from other folks that are on the phone. And you get a 10% rebate on your Academy registration fee for every question you ask.
What? Is it free?
That's a buzzkill question. Yes.
Well, I have a question. This is Jack Spence. Could you maybe run us through one of the cases and show how the scoring system actually worked? I was a little confused by, can you hear me?
Mm-hmm.
I was a little confused by the initial table that concluded that 80 out of 100 points related to public health. I couldn't quite figure it out from that table. I got like 35.
Mm-hmm.
I
see.
Rather than explaining the table, you might just say, well, give us a sort of a detailed accounting of a particular project proposal that was made that you've already reviewed about. And then a follow-up question is, some of these were for the 2040 plan. About what's the targeting for when some of these projects would actually get implemented? Like, there was one I wasn't sure was a real before and after slide or just a, the one in Columbia, Tennessee, James Campbell Boulevard. Okay, there's an after slide, and I don't know whether that's actual or artist rendering.
Oh yeah, no, that was artist rendering. So
okay.
That one, they're in design right now, I believe.
Mm-hmm.
Moving forward, yeah. So Elysia, if you want to go to slide 5, we get our safety, or 80 out of the 100 points are related to public health, safety, in some way. So the categories that are in bold, everything. So multimodal options, you can get 15 points for providing bicycling, walking, or some kind of transit component in your plan. Mm-hmm. Mm-hmm. Quality growth is our term for smart growth. So if you are, that's where you get things like if you're providing a walking or a bicycling connection in a place with a higher, denser area, then you get more points. Or you get points if you're within the urban growth boundary, for example, something in that. So helping target projects that are decreasing the distance that it takes for people to walk and bike is that category. Safety is really all about that's pretty common, but projects that are going to decrease crashes, and that's if a project is described as with the intention of decreasing crashes, then it could get up to 20 points in their review. And congestion management, same thing, being able to decrease the air pollution and make it easier for people to travel throughout the region and having fewer VMT. There's also projects are able to get more points for that kind of analysis as well.
Mm-hmm. Thank you.
If you want, it sounds like it would be helpful for you in particular to get we have a 3-page sheet that goes through each one of these categories. And you can actually see the formula that we use to calculate the evaluation.
Uh-huh.
I can send that to Elysia and Josh.
Okay.
Okay. Yeah, I can get that to you.
Definitely. Thank you, Jack. And we will be sharing Rochelle's information with everybody, too. That way, if you do have any questions that you're not thinking of right now, or later on you decide once you see the presentation again, you can contact her directly. Rochelle, we did have a question here. I know that you work not only in Tennessee, but you work in other states. So the question is, are other cities in Tennessee or elsewhere using this criteria?
I really like the Chattanooga TPOs example as well. So in that document that I told you about before, it's called, what is the full name of it? Elysia, you should send this link around after this webinar, but the full guidebook is called Building Healthy and Prosperous Communities. It was released in December of last year. We have a case study about the Chattanooga MPOs project scoring and evaluation criteria. They had an issue of not, their smaller bicycling and walking projects were not competing very well for federal funding. And a lot of that was because of the scale that those projects were being evaluated on. They were, big projects were really being favored in their project evaluation system because they moved traffic quickly throughout the region. They worked with with two committees to come up with an evaluation process that allowed projects to be examined just at the neighborhood level and had different weights assigned to the different geographic scales. So neighborhood level, community to community, and then region to region. Those are the three geographic scales. And just the way that they weighted their points really helped bicycling and walking projects be elevated. And we have a really detailed case study that goes into that as well in the Building Healthy and Prosperous Communities guidebook. We can send a link to that after this. So they're not exactly the same as ours. They have a different approach, but also prioritize walking and bicycling projects that way.
Thank you, Rochelle.
We also write about the MPO in the Bay Area, Sacramento, and Greensboro MPO in the guidebook. So you can see how they have performance measures and select their projects to meet goals.
Rochelle, can you talk a little bit about what are some of the obstacles some of the obstacles that come with trying to integrate health into project selection?
Mhm. Yeah, I mean, I think with something like this, project descriptions, like getting as much information as we can from everybody about what their project is going to entail. And then how much do we, how much are we there working with the cities and counties and transit agencies as they actually build the projects and make sure that the designs that they promised they were going to do are built at the end of the day. So, that's certainly a challenge we have to consider.
Thank you. Rochelle, I do have another question here. I'll read the question. So the reduction of disease sounds wonderful. Are there any plans to engage municipalities or employers to have programs or incentives to get people to change their commuting habits or their habits to include health? For example, in Amherst, they are trying to encourage people to park further from downtown and have healthy sidewalks and other things like that. So have you seen from any case studies elsewhere something similar where there's such where the municipalities are doing something to encourage their communities to do that?
Yeah. Well, we have a transit referendum coming up in May, and so voters are going to be voting on a $5.2 billion investment in public transportation. And the mayor does talk about how we could be healthier, being able to walk and bike more to those transit stops. So that's kind of the main thing that our region is focused on right now. As far as incentives, the MPO doesn't really take this on head on, but there are more and more businesses coming up in Nashville that actually give some residents lower rent to live in units close to their work. So they have to pay, the businesses pay less in parking because their employees are living right across the street, and maybe they're even making some money off of that. So we're starting to see that, which is really interesting. Check out the HCA headquarters if you're interested in learning more about that right here on Charlotte Pike.
This is Jack Spence again. Is there more information to get about what the $5.5 billion is going for? Yeah, assuming the referendum passes.
Yeah. Yep. Transit for Nashville is the campaign name. So yeah. So we've got light rail on 5 corridors in there. Those would come between 2023 and 2032, something like that. And, in 2019, we'd have faster bus service on 10 of our highest bus lines right now that have the highest ridership. So we'd have 21-hour service, so from, I think, 5 a.m. until 1 a.m. That's only 20-hour service, something like that. Sorry.
It was close, though.
So 20-hour service. Close, though. 20-hour service, and buses departing every 15 minutes, which is progress in Nashville. We don't have that everywhere. So that could be something that happens in 2019, and it's a sales tax increase, and we're expecting that like half of that comes from outside the county because we have so many people commuting in to the county, and we have a lot of tourists. The other thing in there is bus rapid transit on some corridors, and then sidewalks leading up to the transit stations. So, yeah, Transit for Nashville is the website and campaign.
Thank you, Rochelle. And please, again, if you have any questions, write them either via computer or everyone's off on mute. So please just go ahead and speak up. But while you're doing that, just as a reminder that we do have an upcoming workshop on February the 13th. We hope everybody will be there. It's going to be a very interesting, as Josh said earlier, we're going to have great speakers. And then we are also having, the next thing would be our webinar on March 6th, and that webinar is about how to improve public engagement and basically messaging. So we're going to have our on-site communication expert, Steve Davis, talk to us a little bit about that, and then we'll have our March workshop on the 13th. Josh, anything else?
Well, I'd like to add, this is Jack Spence again, that Josh promised us a bright, sunny, warm day on February 13th.
Yes, yeah. But the focus today is not on climate, so we'll have to wait until then. Oh, wait, I'm sorry. I was mixing up climate and weather. So, yes, I did make that promise, but you do have to remember I was elected to public office a few times, so.
Well, if it helps, Josh, I am from California, so hopefully I'll bring some of that warm weather from California.
I'm counting on you, and I know that it's great to have someone responsible for the weather. Thank you.
That being said, I don't see any other questions. As always, I would like to thank the Bar Foundation for their generous contribution for this academy. Of course, T4Mass for being our co-partner and helping out MARPA as well. And also, Rochelle, I'd like to thank you for being our speaker today. It was a great presentation, and as mentioned earlier, I'm going to be sharing her information with everybody, so if you guys do have any questions afterwards, feel free to contact her directly. We will be sharing this recorded webinar with you guys, and also a few other reports that were cited throughout the webinar. That being said, Rochelle, anything else?
No. Thank you.
Thank you, everybody.
Yes, thank you. Well, thank you again. We'll go ahead and let you go 20 minutes in advance. Josh, anything else?
Nope, we're all set. Thank you so much.
And we will be seeing everybody on the 13th. Have a good afternoon.
Bye-bye.
Bye-bye.
Bye.